Let me update you on the work we're trying to do here in the Senate Finance Committee on health care reform. This, of course, is the top priority for President Obama. It's also top priority for the leadership here in Congress, and that's what we're devoting our policy podcast to this week. Well, the chairman of the Finance Committee, Senator Baucus from Montana, asked two other Democrats on the committee, Senator Conrad and myself, to join with him and with three Republicans, Senator Grassley, Senator Enzi, and Senator Snowe, to see if we could jointly work up a bill that could be brought to the Finance Committee for consideration that would have bipartisan support. We've worked through that now for several months. He has now proposed the best bill that he could devise out of our discussions, and that is the bill that we're going to be marking up this next week in the Finance Committee. Well, the Finance Committee bill tries to achieve the various objectives that the President has outlined. First, it does reform the insurance market in that it puts some requirements on insurance companies that issue health care insurance policies. It says that they cannot deny coverage for pre-existing conditions. They cannot put annual limits on the amount that a person could run up in health care costs, since obviously that's something people can't predict. There's a variety of other reforms of that type. It also reforms the payment system within Medicare and Medicaid so as to encourage more efficient administration of those systems, to encourage less waste in the system, and to maintain quality for services provided through Medicare and Medicaid. It also expands coverage, which is a big problem for us in New Mexico. We have a great many people without coverage, and the cost of providing health care to those people, some substantial part of that cost winds up being paid by people who do have health care. So we're trying to reduce the number of people without health care coverage. Also, it does all of this without adding to the deficit. And we have found ways to ensure that the deficit will not rise in the future as a result of this legislation, if we're able to enact this legislation. Yes, now that the group of six has finished its work, the chairman of the committee, Senator Baucus, will present that to the full committee for consideration. We will have opportunities for people to file amendments for the rest of this week, and next week we will have a markup where all members can offer amendments, and we'll have a series of votes to see what kinds of changes in that proposal members of the committee want to make. Well, once we finish the work in the Finance Committee, Senator Reid, who's the majority leader here in the Senate, it will be his job to take the bill that the Finance Committee reports and to take the bill that the Help Committee reports, which that bill was reported in July. I'm fortunate to serve on both of those committees. And the majority leader will take those two bills and hopefully take the best provisions out of both, put them together, and then bring a bill to the Senate floor for consideration, and then we'll have a debate and opportunity for amendment to that bill. As you can see, there are quite a few steps in this process of putting together health care legislation. I hope we are successful in getting to a final result that accomplishes major health care reform. It would be a very good thing for New Mexico if we could do that. And we'll keep you posted on the progress we make. Again, thanks for watching.